will be discussing about how to check for the plantar response. Plantar response is an important component to evaluate the pyramidal tract. If the integrity of the pyramidal tract is lost, then we get an extensor plantar response, that is also known as Babinski sign. So, what is the normal component of the plantar response? The normal component of the plantar response is the flexion of the great toe. It's the flexion of the great toe and the flexion of the other toes. But if the patient is having any pyramidal tract lesion, that is if the patient is a case of a stroke or patient is a case of myelopathy and the patient is having involvement of the pyramidal tract, then this plantar response will become an extensor, that is known as Babinski sign. So, how do we check for the plantar response? Before checking for the plantar response, we should make sure that the patient leg is extended at the knee joint and it is exposed up to the thigh. It is exposed up to the thigh and the patient leg is extended. And then we will try to move the great toe to see if there is any restriction of movement. The patient may sometimes have rheumatoid arthritis or other deformity which may lead to restriction of the movement of the great toe and we may not get the plantar response. So, we should move and see the great toe whether it is moving freely or not. In this patient, it is moving freely. Then we should check the sensation on the sole also by touching with the palm and ask the patient whether he is feeling any sensation or not. If the patient is not feeling any sensation, the sensory system is not intact in the patient, then we may not get the plantar response. If the sole is cold also, then in winter season we need to warm the sole with our palm before checking for the plantar response. Then we should hold the ankle of the patient just above the ankle of the patient. We should not encircle whole of the ankle of the patient like this, but we should hold the ankle of the patient in such a way that we are not obscuring the tendon of the extensor hallucis longus tendon and the other tendon. We will hold side to side with our thumb and our index and the middle finger. We should not encircle the above the ankle joint, but we should hold like this. Then after moving the toe and seeing whether there is any restriction, there is no restriction in this patient, then we will strike the great toe from the lateral aspect of the foot. From the lateral aspect, we will strike the foot from the lateral aspect and come medially. Strike from the lateral aspect, go upward and then come medially. We should not reach till the base of the great toe, as reaching to the base of the great toe may elicit grasp reflex but not the plantar response. So, we should strike from the lateral aspect in such a way that we are reaching the base of the second toe, not the base of the great toe. We will come from the lateral aspect, we will give a pressure and try to observe the movement of the great toe. We will not do in a jerky way, not like this in a jerky way, but the movement should not be too slow or not be too fast. We should come gently and then we try to see the response. We can see this patient is having slight extensor response. If I elicit one more time, you can see that the patient is having extension of the great toe and fanning of the other toe. Extension of the great toe, you can see one more time that the patient is having extension of the great toe and the fanning of the other toe. And we see on this side, we see on the left side in the same way, we will hold this way and then we will move the finger and see whether there is any restriction or not. From the lateral aspect of the foot, we will try to move. Can you see that there is flexion of the toes, the small toes and the big toes? There is flexion of the small fingers and the big toe. So, this side is normal, but this side, can you see that there is an extensor response? There is an extensor response. There is extension of the great toe as well as there is fanning out of the other toe. So, this side the patient is having extensor plantar response. So, what are the component of extensor plantar response? In extensor plantar response, there will be extension of the great toe, there will be fanning of the other little toes, there will be dorsiflexion of the ankle joint, there will be flexion of the knee, flexion of the hip, contraction of the tensor fascia lata. What is the root value of the plantar response? Is the S1. The root value of the plantar response is S1. Sometimes you may get an extensor plantar response and an absent ankle jerk. What are the conditions in which we get an extensor plantar response and absent ankle jerk? If the patient is having taps dorsalis, If the patient is having subacute combined degeneration of the spinal cord, then you may get extensor response with an absent ankle jerk. So we shall also know that what are the plantar equivalents. So if the patient is having a very high degree of pyramidal tract lesion, then sometimes by eliciting the other areas in the leg and the foot, you may get an extensor plantar response. So these are the other technique to elicit the extensor plantar response. The first one is the open hammer test. In the open hammer test, using your index and thumb, you try to move on the anterior part of the anterior tibia, and try to squeeze from upward to downward in the anterior tibia. You may get an extensor plantar response. You may see that the patient is having slight extensor response on squeezing the anterior tibia with your extension, with your index and your thumb finger. This is the open hammer test. You may also squeeze the calf muscle. To get an extensor plantar response. This is the Gordon Gordon technique to elicit the extensor plantar response. And sometimes you, on stroking the or encircling the lateral malleolus or striking the lateral malleolus in an encircle fashion, in a circular fashion, you may get an extensor plantar response. This is the Chaddock sign. And sometimes on pressing the Achilles tendon, you may get an extensor plantar response, that is the Semmer sign. So you may not get all sign positive. These are not the classical finding or the classical sign to elicit the plantar response. The classical one is the striking the lateral part of the foot. But if the patient is having very severe pyramidal tract lesion, very severe stroke, myelopathy, then you may get a plantar equivalent, that is the positive open hammer Chaddock sign. But these are not important or the classical sign, but the name of which you should know.